Hi, everyone. Welcome to a Rittenhouse Open Online course. Today's is going to focus on Going Blue, a look inside Springer Nature's clinical medicine list. Thank you for taking some time out of your day to be with us. I'm your host, Laura, Marketing Director at Rittenhouse. I'm joined by my colleague, Madison McDougall. She's the Creative Marketing Coordinator with us. And from Springer Nature, we have two key editors, Nathalie Lhorset-Poulain, Executive Editor for Nursing, and Richard Lansing, Editorial Director for Clinical Medicine Americas. So before we pass the mic over to our folks at Springer Nature, just wanted to walk through some housekeeping items to get things started. Just a reminder, this is a presentation of a Rittenhouse Continuing Education Series, what we like to call a Rittenhouse Open Online course. This session will be recorded and made available on the Rittenhouse YouTube channel. Audio is muted for participants, so Q&A will be reserved for the end of this session. And you can use your GoToWebinar control panel to submit any questions that you would like. We will address those at the end of the presentation. And just a friendly reminder that handouts are available. We have two handouts today. One is a complete list of the clinical medicine titles that Richard and Nathalie will be going through for you. And another is just more of an informational flyer, an overview of the clinical medicine program that will give you more information on the program itself and the titles within that catalog. Okay, with that, Richard, I'm going to pass the mic to you and give you control. We are looking forward to hearing what you have to present to us.
Welcome, and thanks for joining our presentation today to learn about the Springer Clinical Medicine book program. I'd like to thank Rittenhouse for the opportunity to present our program today, and I'll be doing so along with my colleague in Paris, Executive Editor Nathalie Lhorset-Poulain. Okay, so here's what we're going to cover today. First, I'll say a few words about our global structure. Then we'll cover some facts and figures about the medicine collection. I'll then outline some of the different types of books and book series that we publish, before then moving on to a deeper dive into two of our key fields, surgery and nursing. We'll then conclude with some trending areas in which we're publishing and some of the key partnerships we have in our medicine program. Okay, very quickly, this is the structure of our global clinical and biomedicine team. We're composed of 5 editorial directors in the various regions you see here, the Americas, Europe, and Asia. I manage the clinical medicine team in the Americas with offices in New York and Sao Paulo, Brazil, with a total team of 13 editors. Across all the teams around the world, we have a total of 110 editors signing and publishing books in both clinical and biomedicine. So now I'll cover some brief facts in relation to our program. First, though, I just want to do a quick differentiation of clinical medicine versus biomedicine. Clinical medicine pertains to the hands-on practice of diagnosing and treating patients. Biomedicine, on the other hand, is the earlier, largely laboratory-based research activity that makes clinical medicine possible. That's where scientists research how physiologic and biochemical processes and pathways operate on the body. Now, for some background about our program. Unlike our competitors, the Springer Clinical Medicine Global Book Program is truly comprehensive, publishing books in all medical specialties. Altogether, the clinical medicine team globally publishes about 900 books per year. We boast a number of long-standing and well-known quality programs in major clinical areas, especially surgery, radiology, oncology, and orthopedics. And we've consistently outpublished the competition in most fields for the last 8 years, positioning us really as the leading publisher of clinical medicine books. Our volume editors and authors include key opinion leaders from all of the top academic health centers throughout the world, such as the Mayo Clinic, Massachusetts General Hospital, Imperial College London, Cleveland Clinic, and many others. Okay, so to illustrate that with some data from PubAlley, here we can see that Springer Nature is the market leader in clinical medicine titles published over the last 3 years, with close to 1,000 or a little more than 1,000 titles published each year. And there's no doubt that will be the case again in 2022. Our key competitors in clinical medicine tend to publish in only certain fields of medicine rather than across all specialties as we do. Okay, and given that we generally have been publishing more than double what our closest competitor publishes globally the last several years, it's no surprise that we have dominant market shares in practically all the key areas of clinical medicine. You can see here market shares of 30, 40, and 50% or more in many fields. If you focus on the dark blue bar at the bottom here, you'll see that in 2021, we ended with 62% of the market in surgery titles published, doing that by publishing 103 books. Below that, you can see we had 10% of the nursing market last year, which I think is really excellent, given that we only started publishing in nursing about 6 years ago. And Nathalie is greatly responsible for this growth and success. And as I said, she'll discuss that program shortly. So now a little bit about the various book product types that we publish.
Textbooks and board review titles are key product types for us. The reason for that is that students make up one of the dominant user groups of our Springer Link database. So for the last several years, textbooks for medical trainees, which are medical students, residents, and fellows, and board review titles for trainees and experienced physicians have become key publication objectives for us. Experienced physicians and trainees basically use our content to update their knowledge and skills to pass their board certification or recertification exams. The majority of product types we publish in clinical medicine are what we call professional titles. These are single authored books or contributed volumes. And contributed volumes are books developed by a range of chapter authors. The physicians who read or purchase these books are typically working in private practice or hospitals and primarily treating patients, while the other segment of these buyers and researchers are physician scientists who work and teach in academic medical centers where they're not only caring for patients, but also teaching medical students and residents and also doing their own research and publishing in clinical journals and or books. We publish a lot of atlases and major reference works as well. In terms of atlases, which are image-intensive publications with small amounts of text that explain the images, Springer's Medical Atlas program has the largest collection of color images and hand-drawn complex illustrations in comparison with our competitors' programs. The dark blue titles at the bottom are examples from our major reference work program. The MRW titles are large books, generally about 1,000 pages or more, and provide authoritative overviews of a clinical field or topic. Our medicine MRWs achieve outstanding online usage from medical students, residents, fellows, and to a good degree, even experienced physicians. Open access is not only a major movement in journals, but in books as well. And in 2022, Springer marked the publication of its 2000th open access book across all disciplines since starting the program in 2015. We currently have about a 35% share of the open access academic book market. For open access titles, authors or their funding bodies pay for the publication costs of the book, and it is then openly available to anyone on the web, not just those who are within the Springer Link system. And there are strong reasons to publish open access, with OA books achieving 10 times more chapter viewings, 2.4 times more citations, and 10 times more online mentions on social media sites and research or news sites in comparison with a book in our Springer Link database. Book series are another important product type for us. In addition to standalone books, we also have a good number of successful book series in clinical and biomedicine. Some of our book series started 30 and 40 years ago or more. These are just some of the most successful series we publish in medicine and biomedicine. Book series are led by an expert series editor, or sometimes two, along with the in-house publishing editor, and together they conceptualize topics and identify volume editors and authors to develop the books. Many of you know the database Scopus. Scopus is a highly used, important abstract and citation database that indexes nearly 25,000 titles from about 7,000 publishers, of which about 35,000 are peer-reviewed journals in the health sciences, life sciences, social sciences, and physical sciences. Getting a book series accepted into Scopus is not easy, and it's something we try to do as much as possible. Here are 9 of our series in medicine, biomedicine that are part of the Scopus platform. Okay, now we'll turn our focus to our surgery and nursing book programs. Springer is a very well-established and highly respected publisher in surgery, covering all areas of surgical procedure: general surgery, colon and rectal surgery, thyroid surgery, breast surgery, neurosurgery, as well as a range of others. From 2016 to 2021, we published about 550 surgery titles. Our authors and editors represent a wide range of international thought leaders, and our publications range from established textbooks and review guides for trainees to professional titles and full color atlases. Here you can see how dominant our surgery book program was from 2018 to 2021 in comparison with our top competitors in this category. In this time period, Springer published approximately 440 titles globally on all of the different subjects related to surgery. These are some of our current leading surgery titles. The first title, Surgery, a Case-Based Clinical Review, is for medical students to help with their surgical rotation and exam, but it's also purchased by residents, nursing students, and physician assistant students. The first edition sold more than 13,000 copies, and the second edition, which was published in 2020, has already sold more than 6,000 copies. The second title is the only bariatric surgery textbook developed by the American Society of Metabolic and Bariatric Surgeons. And the last book here is the official textbook of the American Society of Colon and Rectal Surgeons, and it's now in its 4th edition. You can see in the lower left corner of the cover of that book, the white box with more media listed. That is an app program that allows readers to scan an image and go to it directly on SpringerLink to see it in more detail. And we have that feature in a good number of the books that we publish. We have strong partnerships with key surgery societies in the US and Europe, including the Society of American Gastroenterologic and Endoscopic Surgeons, or SAGES. The titles here represent just one specific program within all the SAGES books that we publish. These 8 manuals are part of the SAGES University Masters program. The manuals are beautifully illustrated, offering state-of-the-art laparoscopic and endoscopic procedures in easy-to-use outline form. Okay, so now we'll move to our global nursing book program, which Nathalie will cover. Nathalie, over to you.
Thank you very much, Richard. So I'm going to give you an overview of our expanding nursing program that we have launched in 2016. This was a really needed program, actually, aiming at meeting the new educational needs of nurses we serve globally. So we published so far over 120 titles, authored by high senior academic nurses, and 50% of them are from the US. So since 2016, we have developed a strong partnership with the International Council of Nurses, representing 28 million nurses, and we created a series about advanced nursing practice. Each year, we launch a social media campaign for the International Nursing Day that is cross-promoted by ICN. So we publish high-quality books in open access with some impressive downloads, 2 book series, one about advanced practice nursing, the other one is about specialty nursing, and the third one is about geriatric nursing. We cover major specialties like oncology, mental health, cardiology, to name a few, but also some transversal hot topics like leadership, research, social determinant of health, all meeting sustainable development goals. So now let's take a look to a selection of those nursing standalone titles to give you an idea. Most of them are led by US leaders in nursing from Penn University, from NIH, from Johns Hopkins, etc., and in various fields. On the top left, we have a book about aesthetic procedures, which is one of Springer bestsellers. And next to it, we have two society textbooks and two society endorsed textbooks, one about neonatal nursing, endorsed by the board of the International Council of Neonatal Nurses, and the other one about endocrinology nursing textbooks that is endorsed by the European Society. And they are working currently on the second edition. And I'll let you discover the others. A few other titles led by US nurses about neurocritical care, compassionate care, menopause, or pediatrics. And at the bottom of the slide, we have a few titles to be published in the coming weeks, just to give you a flavor of the variety of the nursing topics we cover. And to conclude about nursing, a few words about the Advanced Practice Nursing series I mentioned previously, which is endorsed by the International Council of Nurses, who reviews each title and promotes the series toward their million of members. So far we published 8 titles, almost 9, with prominent nurses editors, and many of them are from the US. It's about strategic planning, leadership, clinical nurse specialist or nurse practitioners roles. And this series addresses topics related to APN practice, education, management, policy and regulation, leadership, and research. And it is meant to facilitate the clinical reasoning and decision-making process of nurses and to present the evolution of APN at an international scale. And of course, ICN board members also contribute to the series. So I'm open to any question at the end of this presentation. Thank you very much. I'll give back the floor to you, Richard.
Thank you, Nathalie. All right, as everyone knows, medicine is constantly evolving and new trends and whole new fields continually develop. We stay abreast of the trends and publish in these areas as much as possible. Artificial intelligence and personalized or precision medicine are the hottest, still emerging fields in medicine. And you can see here a handful of the titles we've published in these areas. These trends offer really exciting new directions in medicine and have allowed it to evolve toward a more personalized approach where treatments can be more biologically targeted according to a patient's genetic makeup. The proliferation of artificial intelligence in medicine and of genetic and genomic medicine and regenerative medicine are state-of-the-art fields, and we plan to publish a lot in these areas in the coming years. Okay, and to wrap up here, these are just some of the many partnerships our clinical book program has with associations and societies around the world. A handful are shown here. The American Society of Colon and Rectal Surgery, the European Society of Pathology, the European Society of Radiology, the American Thoracic Society, SAGES, and the International Council of Nurses. These are just some of the publishing partnerships we have established over the years, and we're very proud of all of them. Okay, so that concludes our brief overview of the Springer Clinical Medicine Global Book Program. Nathalie and I truly appreciate your interest and time today. And I'd like to thank Rittenhouse once again for allowing us to present. We would be happy now to answer any questions.
Richard and Nathalie, thank you so much for that overview of the clinical medicine program, and especially the deep dive into the various specialty areas that you all cover. So before we get into the Q&A portion, I just wanted to give a brief overview of how our Rittenhouse customers can access these vital resources. So print titles are available through rittenhouse.com, and a select list of ebooks from these programs are currently available on the R2 Digital Library. There is a special collection on the R2 Digital Library that lists all of the active ebooks from the list. And if you're new to R2, reach out to us if you're interested in getting started with a free trial. Okay, and now, without further ado, we're going to move into the Q&A portion of today's presentation. So again, if you all have any questions, please feel free to put them into the question area of the GoToWebinar control panel. And we already have a question coming in. One is precision medicine being taught in medical school curricula?
That's a very good question. Yes, it is. And it's primarily taught through genetics courses that are part of the standard curriculum in medical school. And so, you know, that's really what happens in teaching precision medicine, because it's really all about genetics, which is the individual gene makeup of an individual, and then genomic medicine, which is the total makeup of the genetic profile of a patient. In other words, gene-based therapies are focused on looking at the actual disorder that's going on there in the patient and seeing which genes are playing a part, and then trying to target or tailor the treatment specifically that way. Whereas genomic medicine is looking at all of the genes that make up a patient. And so, I mean, that's just part of the curriculum. But yes, it is being taught. I'm not a physician, so I can't really go into a deeper dive than that. Yeah.
Sure. Okay, very good. Thank you, Richard. And then another question that came in is about virtual reality. Are there any plans there with the clinical medicine program?
Well, yes. I mean, we've published some titles through our informatics book program, which is quite successful actually, and a long-standing book series. So virtual reality has come to the fore in certain fields, especially neurology, to a certain degree with psychiatry, certainly with robotic surgery to a certain extent. And so the answer is yes. I mean, I would put that into the general area with artificial intelligence. And so, you know, these areas are just greatly expanding right now.
Okay, fantastic. And I think we have time for one more question. And Nathalie, this question came in, which I think would be appropriate for you. So just curious about which topics and types of books in nursing are the most popular?
Well, actually, textbooks and guides endorsed by society with a multidisciplinary approach are the most popular, I would say. And advanced practice books also become more and more popular. In terms of discipline, we had some very successful books on endocrinology and mental health and oncology.
Hi, this is Jenny Liu, Senior Trade Sales Manager for the Americas at Springer Nature. I'm here to answer the question, how is Springer able to publish so many more titles than other publishers? So Springer is able to publish more titles because we have a large editorial team that's dedicated to partnering with leading doctors and societies around the world. With that large list, of course, we have to disseminate what books are of most interest to our customers. So on a quarterly basis, the sales and editorial team identify and prioritize key medical books that are most relevant to students, doctors, and other allied healthcare professionals. In turn, we partner with the Rittenhouse sales and marketing team to highlight the books that are the most important to the medical community. We present them, we highlight them in marketing features, and we do webinars just as the one that you have seen. If you have any questions about our books, feel free to reach out to the Rittenhouse team. And of course, our books are available on R2 and as print through Rittenhouse.
Yeah, Fantastic. Okay, thank you so much. And I think we're going to be wrapping things up. We are at time. Natalie and Richard, again, thank you so much. You are a valued partner of Rittenhouse, and we appreciate you all joining us to present the clinical medicine list and a deep dive into the various titles. And to all the attendees, thank you for your time and spending time with us today for this Rittenhouse ROOC. A reminder, don't forget to grab the handouts, and a recording will be available on the Rittenhouse YouTube channel. And for more information, you can contact marketing@rittenhouse.com. Again, thank you so much and enjoy the rest of your day.